Hey guys, Cass Nelson-Dooley here, author of Heal Your Oral Microbiome and integrative and functional medicine consultant. Did you know that there are 6 bacterial infections that can increase your risk of heart attack, of stroke, and of high blood pressure? Well, if you haven't heard of it from your dentist or from your doctor, you're not the only one. Even though we have decades of research behind us about this connection, the oral systemic link, dentists and doctors aren't talking to us enough about it. So let's talk about what you can do to address the oral systemic link. Let's talk about the 6 mouth infections that you need to beware of if you have heart disease. And we'll talk about the symptoms to look for if this applies to you. Thanks. If you are troubled with heart attack risk, stroke risk, high blood pressure risk, there's a really important potential contributor to your condition that most clinicians and dentists are not talking about, and that is your mouth infections. There are 6 critical mouth bacteria that can contribute to heart disease and stroke. And I think you need to know about it, as well as doctors and dentists need to be talking about this more. Your risk of heart attack is 50% higher if you have gum disease. There's actually lots of evidence behind the connection between the mouth and the heart. This evidence has been building up for decades. So if your clinician and your healthcare team and dentist are not talking to you about this, then they're missing the boat, unfortunately. Here's some other things that we have learned that really kind of prove the oral systemic connection, which is the idea that the mouth is connected to the heart and the rest of the body. Mouth bacteria have been found in atherosclerotic plaques. So heart disease and the building up of plaque in arteries is something that you can find mouth bacteria kind of in those little deposits, especially in people who have had heart attack and stroke, and these atherosclerotic plaques have blocked blood flow. And then killing mouth bacteria with something like mouthwash can actually increase your blood pressure. So we know the mouth and the heart are connected. And then what if we turn it around? What if you treat the mouth? Then what happens to the cardiovascular system? Well, it bears out. If you floss and brush more, you decrease your risk of heart attacks and stroke. If you floss and brush more, you decrease your systemic inflammation. And that is a driving force of heart disease. So the evidence is really strong. You know, I had a friend in the oral health industry tell me, I think the oral systemic connection is kind of old news and it's not exciting anymore. And I have to differ. I don't actually think that's true. And the reason is because people are not talking about it enough and people are not treating it enough. It's not common that you'll hear from a dentist or a primary care provider about pivotal oral infections that are contributing to heart disease. So all of us need to be more aware of this and talking about it and addressing it as a way to prevent heart attacks and stroke and high blood pressure. Okay, so let's dive in here. We're going to talk about treatments. We're going to talk about testing, and we're going to talk about how to balance the oral microbiome. But first, I want to talk about these 6 infections. And these bacteria, they are correlated with gum disease, right? That's where all of this is starting, is with gum disease. And actually, over 50% of adults in the United States over the age of 30 have gum disease or a version of it. So this is actually a pretty big deal for anyone who's 30 years or older. What you're looking out for with gum disease is bleeding gums, loose teeth, deep periodontal pockets that your dental hygienist and dentist might be telling you about. What happens in gum disease is that it's a bacterial imbalance in the mouth, particularly with some of these bad pathogens playing into it. And then there's inflammation and there's toxins produced that damage the tissue. It causes damage to the gums. It causes damage to the bone. Teeth can fall out, but it's really ultimately the immune system fighting this bacterial imbalance that damages the mouth so much. So some of the bugs involved, we're going to start with 3 pathogens. And these are called the red complex periodontal pathogens. Porphyromonas gingivalis. This is a bad guy. These are pathogens, meaning they cause disease, and it's pretty well accepted. That's the only thing they do for us. They don't really do good things for us. Another bug in this triad is Tannerella forsythia. And the third one is Treponema denticola. So these are the red complex pathogens, bad guys, almost always involved in gum disease. Then we have 3 opportunistic bacteria. So opportunistic bacteria are different than pathogens, right? Opportunists are more on the fence. They are bacteria that are normal and common, even in healthy people. They may not cause any trouble at all. But in the moment that they get an advantage, when they get a leg up, they can take over and create disease. So these are opportunists. And pathogens and opportunists are distinct from commensals, right? These are our good bacteria, the beneficial ones that protect us from the bad ones and do all kinds of great things for our health. So not all bugs are created equal, and it's important to understand those distinctions when we talk about the oral microbiome or the gut microbiome, right? Not all bugs are the same. Not all bugs are bad. So these opportunists, they can be a problem, or they also might not be a problem, but they are implicated in gum disease also. They often can get involved and be working together with these red complex pathogens. So this first one is a mouthful. It's Agregatibacter actinomycetum comitans. And I think every microbiology student probably fears that bug. This is the hardest bug name I've ever had to pronounce. Also, we have Fusobacterium nucleatum and Prevotella intermedia. So those bugs are also involved, like I said, in gum disease, and they can be involved in heart disease. So how do these 6 mouth infections, we know they can cause problems in the mouth, but how do they cause problems in the cardiovascular system? Why do they increase the risk of stroke and heart attack? One is that they trigger inflammation throughout the whole system. They create toxins. They create an immune response. So they're kind of setting the whole cardiovascular system on fire, essentially. They can actually damage artery walls. They can increase plaque. They kind of increase like the stickiness of cells so that they're more likely to clump together and create plaque. Of course, we know that plaque that gets dislodged is very dangerous because it blocks blood flow. And like I said, these bacteria themselves have been found high in these atherosclerotic plaques. So they're problem bugs. They create problems, and they are a huge risk for heart disease. So you can learn more about these bugs. I provide a lot of research and the evidence behind them on my blog for February 2024, 6 mouth infections you need to get rid of if you have heart disease. So what can you do about it, right? Let's get to the nitty gritty here. What if you want to address these 6 infections? Well, here are some tips. There's 3 parts really. One is test the oral microbiome, test for these bugs. Second is to get rid of the bad bugs. And third is to build up good bugs. And I will start this out with saying you need to have a good team, right? You need to have a dentist and a primary care doctor that understands what's going on here. They need to be testing, and they need to be checking CRP, if you ask me. So in my blog, you can get a link. I've also written a blog on how to find a biological or holistic dentist, so you can also look there. So first step is test, right? And finding a dentist that is testing the oral microbiome and looking for these pathogens is a very important part for your progress on this path. You can test the oral microbiome. You want to test for those 6 specific species. You can also look at more, right? It's not just these that are involved in the mouth. And like I said, you also want to test CRP, C-reactive protein, a marker of systemic inflammation. And it's a good marker of the oral systemic link. Second step is to get rid of the infections, right? So work with your dentist, work with your possibly your integrative and functional medicine provider. If you don't have a dentist that knows what's going on related to this, you may need periodontal treatments like scaling and root planing, especially if these mouth infections are very deep in deep pockets. You may need antimicrobials or antibiotics to address these infections. And that is okay as long as it's under the guidance of an informed provider who knows how important the good bacteria are to your health as well. And that leads us to building up good bacteria, right? That's really important. Building up good bacteria with a healthy diet, right? A diet that's high in fiber, whole foods, plants, prebiotics, colorful fruits and vegetables. This type of diet is going to feed good bacteria and starve out bad bacteria. You can also take dental probiotics to, deliver good bacteria right to the mouth. There's probiotic mouthwashes. There's a lot of good things you can do to kind of feed and seed the good bacteria in the mouth. So those are our main 3 steps there: finding a good team, eating the right diet, testing, and getting rid of bad infections, and building up good bugs. So these are great tips to improve your oral health and your heart health. I think testing and addressing these infections may be the most important thing you or your loved one does for heart health. And we need to be talking about it a lot more all across the board: practitioners, professionals, and consumers. So if you like this type of information, please check out my e-newsletter. I send out a new evidence-based blog every month in my e-newsletter. You'll also find discounts to oral health products and integrative and functional medicine products. You can also check out my book, Heal Your Oral Microbiome, and I'll be back next time with some more evidence-based natural health solutions to chronic illness. Thanks so much.